In today's episode of Thomas Rambling While Taking a Walk, we've got a juicy question. Have I ever helped clients with dysautonomia, and if so, what has helped? I worked with a lot of clients that have dysautonomia. I think it's a clinical condition that most herbalists should know more about. It's very common in post-infectious illnesses and chronic fatigue syndrome, both of which are conditions that modern medicine doesn't acknowledge that well, has no great test for, and doesn't have a lot of treatment options for. It's very common, and I worked with boo-koodles of cases. It's a lot more common now since COVID. It is a very common manifestation of post-COVID syndrome. It is often transient. That means that it comes with the infection and then lingers for a few weeks to a few months, and often resolves, except for when it doesn't. Let's talk about that. Causes and differentials. The number one thing that dysautonomia leads to is orthostatic intolerance, where you get dizzy when you stand up because your autonomic nervous system, is not regulating your blood reserves and volume reserves very well. So when you stand up, your nervous system should trigger your vessels to constrict in your extremities and hold blood up in your brain. And when it doesn't do that, we get dizzy and can sometimes pass out. This can also lead to increased heart rate as the body tries to compensate for the sudden drop in volume. And so postural orthostatic tachycardia syndrome is probably the most common variant or subtype of dysautonomia, which is a pretty broad category. There are other things that can lead to orthostatic intolerance that need to be considered and ruled out before thinking of it as dysautonomia. Anemia can lead to it, dehydration can lead to it, and even deconditioning from prolonged bed rest can lead to orthostatic intolerance that looks like and feels like dysautonomia, but is not and isn't treated the same way as dysautonomia. The most common causes of dysautonomia are neuroinflammation, either from an infection, which is very common since COVID, or from autoimmunity. You can have dysautonomia secondary to neurosjogren's is a pretty common cause of POTS and dysautonomia. And then you can have dysautonomia directly from nerve damage in the central and peripheral nervous system. We want to make sure that it actually is dysautonomia, and then we want to manage the symptoms. So when blood volume drops and you get dizzy, you might fall over and hit your head, and that's not good. We want to increase blood volume then, and the easiest way to do that is, or fluid volume, really. The easiest way to do that is with salt. People with dysautonomia often need an additional 3 to 10 grams a day of salt. There are rehydration packets. You can make your own rehydration salts, and all of them are characterized by being really high in sodium, which helps your body retain fluids. In mainstream medicine, they also will use a medication called fludrocortisone, which helps to retain fluids by interfering with or mimicking aldosterone. You can get similar results using licorice. The problem with fludrocortisone and licorice is you can get increases in blood pressure. So you got to keep a close eye on blood pressure when using either of those. Salt is really helpful. Abdominal compression stockings are common recommendations. Herbally, I think one of the things that everybody with dysautonomia can do safely is try Stachy's botanica, try wood betony infusions. About a quart a day seems to be really helpful. And then we have to target the cause. Is it neuroinflammation? Is it autoimmunity? Has there been nerve damage? I think that you should work with a clinical herbalist in identifying the root cause, but you can absolutely manage symptoms of dysautonomia yourself and play with salt levels and potentially licorice and compression clothing. I actually wrote a whole patient guide to dysautonomia to go along with my long COVID course, and now people that have finished that course are using it with their clients. There's a lot that you can do for dysautonomia. There's a lot that herbs and herbalists can do for dysautonomia. I do recommend working with a clinician, though, so that you can identify the root cause and not just palliate the symptoms, which is important. And, I encourage you to try. Also, dig deeper. Hope this is helpful. Catch you next video.